Modernize. And now it's my pleasure to introduce Dr. Todd Johnson with Access Family Medicine. Todd, take it away.
Thank you, Steve. Hey, thanks for the time that you're allowing me to visit and talk to everybody. Many familiar faces out there. A shout out, say hello to all of you, and it's nice to meet some of the newer faces. So with my talk today, there's a couple different elements I want to make sure I hit. I know part of the goals for today are certainly to hear about my business journey, hear about some wins and losses and lessons that we may have had during the way, and then some of the what keeps you going pearls that are out there. So my business is very unique, so I'm not trying to give a pitch. Don't take it that way, but there's a lot of education that goes in behind what we're doing here. So I just want people to understand how it works. And I do welcome questions at the end. Very welcome to do that. So I did put together a PowerPoint presentation, and that's more to keep me on track. And when I have some of these pearls and tidbits, I'll make sure I stop and pause for that. So I'm going to go to screen share at this point, Steve, if that's up and running. So I titled this presentation, Modernize Old School Medicine, because some of you may remember what it was like to go see your doctor back in the day, where you just had one physician who took care of most everything for you and would send you to a specialist or to hospitals only when necessary. With the advent of technology, we can actually modernize old school medicine just like it was in the old day. And our main focus really is that relationship. I have patients talk to me all the time and tell me that you really care. You have that relationship piece that my old doctor used to have. That doesn't exist anymore. And I just say, thank you. That's exactly what we're trying to do. So a couple goals I want to review is, what exactly is direct primary care and why did I choose it? So I'll go into my journey a little bit with that. So pearl number one, what are some of the things that keep me going every day? And we came across this quote and it just resonated with my wife and I. In today's world, what is considered mainline and the mainstream may not actually be the right thing. And if everyone's doing the wrong thing, doesn't mean it's right. And because nobody's doing something doesn't mean it's wrong. So we look at each other every day and say, every day we want to make sure we're doing the right thing, even if nobody else is doing it. And that's part of our motivation that keeps us moving. So a little bit about myself personally and some of my history and my journey. I was born in Omaha, Nebraska, the oldest nephew of Vondra's husband. So thanks for joining, Vondra. And we moved away to Pennsylvania. I actually was raised in Pennsylvania, went to kindergarten, graduated from high school there, and by coincidence, we moved back to Nebraska, so back to our roots. I ultimately ended up at the University of Nebraska. I got my bachelor's degree in '95. I got my master's degree in '96, and then I moved east to Des Moines, where I got my medical training and my doctorate of osteopathic medicine in the year 2000. After that, I ventured to Traverse City, Michigan, which is at the tip of the mitt for any of you who are familiar with the topography of Michigan. So we're right on Grand Traverse Bay, the northwest tip of the Lower Peninsula, and it's really considered God's country. The #1 industry there is tourism. Many people from Chicago and Detroit have summer homes there, but the #2 industry is healthcare. It's a rural area, and it was a perfect place for me to go and train and learn at that time. We spent 3 years there. We graduated in 2003. Then we moved back to Lincoln, which was home for all of us. And I joined one of the larger corporate groups and worked there for 13 years. During those 13 years, I was asked to be a physician champion for multiple model designs. And those are delivery care models that we were trying out and doing. And during those years, I was groomed into some leadership roles. Most importantly, probably the quality medical director, as well as the practice medical director for our local groups. And with those experiences, we were looking and trying to deliver better healthcare delivery models. And with that in mind, part of my goal was to seek out all these different models that other people are doing across the country and try to find something that fits our goal, fits our mission. And so the rest of my story goes, I remember very clearly one day sitting in my exam room, listening to my patient and knowing exactly what they wanted. I knew the diagnosis, I knew the treatment, but I wasn't able to do it for them. It wasn't within the scope of what the system would allow for us to do. And it wasn't even anything controversial. It just wasn't the way we do things. For those of you who aren't familiar with healthcare, there are certain documentation requirements, and there's certain coding requirements, and there's certain things that are covered and things that are not covered, and how will the third party pay for it? We don't have a way to collect from the patient, so we just don't do them. And I felt completely frustrated that I knew exactly what this patient needed, but I was unable to provide it. So that extended and kind of lit that burning fire under me to look for other healthcare delivery models. So the next page is, I remember clearly getting an email in my inbox and thinking to myself, I don't have time for this email. And will karma just play itself out? If I open this email and just entertain it, will it stop showing up? Will it stop flooding my inbox? So I opened it and I read it. And then I looked at it and I had to reread it to make sure I was understanding it correctly. And then I tagged it so I wouldn't lose it. So after work that day, I went back and reviewed it, and I came home and I remember clearly speaking to my wife and said, I read about this new delivery care model. And she sits back and rolls her eyes and says, oh, great, another one. How's this going to work? And because it was so unique, I just fumbled and bumbled over all of my words and couldn't explain exactly how it worked. And she looked at me, gave me a hug and said, sounds great, honey. Don't quit your day job. So what I had to do is go back and really dig in deep and understand what it was. And when I came back and I explained it to her and I went over it, her eyes just lit up. She said, this has some meat. This has some traction. How do we learn more about it? And for any of you who go to conferences or required to do any education, at least in the healthcare field, there are no continuing medical education courses that are close by to the Midwest. You always have to go to remote, exotic places, and they always charge an arm and a leg. Well, again, karma is lining up because I found out this was a weekend course in Kansas City for $200. And I looked at my wife and said, worst case scenario, this is a date weekend for us. So let's just peel off our rosy colored glasses. Let's go in undercover. Let's wear disguises and let's ask all the tough questions. Let's dig deep into this and try to figure out, okay, what's the catch? What's the gotcha? What's the gimmick? And let's figure this out. And we did, and we went, and we asked the tough questions. And we came home, we just looked at each other and said, this can really work. This has some traction. This is trying to accomplish all the things that we're actually trying to do. And it's not perfect, but where there are imperfections, there are at least solutions, there's options for us to choose from. So with that in mind, we spent the next 9 months digging deep, doing our research, doing our homework, doing field trips to other practices who are deploying this to try to learn about it and figure it out. And then came Judgment Day. Are we going to do this or are we not going to do this? And if any of you have ever been to the Grand Canyon, there's many parts of the Grand Canyon that do not have guardrails. They don't have fences. You can walk right up to the edge and look over and it is straight down for 5,000 feet. And it can turn your stomach at times. Well, that is the feeling I felt on Judgment Day. I looked over, came back, looked at her and I said, I don't want to do it. I have too much responsibility. I have to take care of you. I have to take care of the family. It's too risky. I truly believe it can work. I don't want to be that guy. And she looked over and said, yep, that's a big jump. And I agree with you. I think it's going to work. But there's no one better to do it than you. And she kicked me over the edge. So there you have it. So we've been fortunately the security parachute deployed, and it hasn't been perfect. It's been rough. It's been bumpy at times, but it has been an adventure. It has been fun, and here we are today. So with that, we'll come back to some other business journey. One of the big misunderstandings about direct primary care is that it's concierge medicine. So, and nothing against concierge, but we are not the same thing. We have a lot of similar elements. And let's first define what concierge is. So concierge is a membership to belong to a doctor's office. So let's use the example of a country club. Country clubs have different fees to belong to their club. And if you pay those fees, you can belong. But there are still charges and costs to belong to the club. Oftentimes, food and drink is not included, and it's probably not less expensive. There are parties. There may be an entry fee for a party. There may be fees for the golfing. You get the idea. And that's what concierge is. So you are joining a club to belong to a doctor, and he's still going to charge your insurance. You're going to still be responsible for co-pays. You're still going to be responsible for all out-of-pocket costs. So it is not exclusively the same. So with that being said, what is direct primary care? The biggest similarity is that it's membership based. But instead of being a country club, think of Netflix. With COVID, Netflix is, taking off gangbusters, as well as all these other entertainment apps. But think of Netflix, you pay your $20 membership fee every month, and you have the entire library at your disposal. You can watch any show, any movie, anything you want within that membership. So that's what direct care is. With that membership, you have direct access to your physician anytime, any way that you need. In exchange for that, we don't file any insurance claims, we don't collect co-pays, and we don't charge any deductibles. So a lot of people, ask, and they just don't understand, why don't you bill insurance? What is the issue? Why? We have insurance, we want to use it. We like you, but we want to use our insurance. So what's the difference? A lot of people don't understand the number one piece of overhead in a physician practice is filing for insurance claims, trying to get paid from the insurance companies. So the average number is 40%. So I decided, hey, if I can cut 40% off of the top in our practice, and I just hand that directly over as savings to our members, to our patients, we can drastically lower the cost of healthcare. And I'll get into the fact that I'm not anti-insurance later, but by eliminating that factor, we can actually deliver better and more affordable care. In our practice, we like to say we're full scope family medicine. Now, I've learned that a lot of people don't even know what primary care is. So what does that mean? Yes, we take care of coughs and colds and runny noses. Yes, those are urgent types of things. But a lot of people don't realize that we do office procedures. We perform stitches. We often will do dedicated and detailed exams in our office. We also take care of chronic things: asthma, diabetes, high cholesterol, high blood pressure, cancer survivors, heart attack survivors, COPD, depression and anxiety. So all of these things we can take care of in our scope, and try to eliminate the need for people needing to go see so many different specialists at those rates. So with that in mind, we help coordinate the care for all those folks, and we still utilize specialists when necessary, when it's outside of the scope of what we do, but we should be the first stepping stone for most everybody. In addition to what we do, it's unlimited office visits. I had a nice conversation with the business owner yesterday, and he said, what happens if my employee needs to come in 2 or 3 times that month? And I say, remember Netflix? You're not cut off. You can watch that movie several times if you want to. If you need to come in 3 or 4 times a month, it's there. It doesn't cost you any more. And quite honestly, if I'm not doing my job, you might need to come more often. So my incentive is to take good care of you. In addition to access to us, I wanted to sweeten the pot. So everything I've said so far is the baseline, the standard for direct primary care, the membership-based part, no insurance claims. But after that, each delivery care office, is like a snowflake, and they're very unique. I wanted to sweeten the pot for our practice. So we've decided to offer office procedures at wholesale pricing. And wholesale basically means cost. So the cost of the procedure is basically the cost of me to buy the supplies to do the procedure. An example would be to put stitches in. I know the cost of the supply of the suture needle, the lidocaine, the injectable needle, the syringe. the surgical tray, to put all that together. So in our office, it's $50 to have simple stitches put in. And that's a membership benefit. You get that as a member. You can compare that if you went to urgent care. Obviously, it's going to cost, $80 to $90 just to walk in the door, and it's usually going to cost about $200 to put those stitches in. So your cost savings are obvious in that setting. The next level of value that we wanted to bring was wholesale or cost pricing on lab work. So when you draw blood, imaging, if you need x-rays or CAT scans or MRIs, and medications specifically. We deliver medications, we dispense them right from our office. Now, if you want to go to Walmart or Walgreens to get them, we can certainly do that. That is not a problem. We wanted to offer a service that we have medications available to you at wholesale pricing in our office. So 2 quick examples. I thought the Walmart $4 menu was going to be my biggest threat, my biggest enemy. What I learned is I can still beat the Walmart $4 menu. Never in my wildest dreams did I think I was going to be able to. I figured Walmart was just throwing out loss leaders to get people in their door. Not the case. They are still making money on their $4 drugs. But what I can do is actually give you the same products, even cheaper. And you can get them directly from us in our office where you don't even have to go and stand in line or park at Walmart. Nothing against Walmart. They do a great job. What we are doing is adding more and more onto our menu as we go along. Now we have durable medical equipment like CPAP machines and crutches and splints. We're adding on outpatient testing. So whether someone needs an echocardiogram, a stress test, or a Holter monitor, pulmonary function testing. Now we have colonoscopies that we can set up for people. The average cost savings of a colonoscopy, so this is where the value really makes the biggest impact. The cost savings of a colonoscopy will save the average family 2 full years of membership. You just bought 2 years of membership by getting your colonoscopy with us that way. Now, having done that, you think, okay, well, where am I going? Who's going to be doing this procedure? Good questions. It's the same physician at the same facility, at the same location as you normally would go anyway. It's just how you pay for it. That's the only difference. And now we're adding on. Physician and specialty consultations are working with us. We have cash pricing on that. We're even scheduling cash priced surgeries for people. I've had people who are saving thousands of dollars by working through us, through our network of surgeons who accept cash at the time of the procedure and doing it for a fraction of the cost. That's going to save them money. I have a guy, actually, he's there today. He's getting a lump taken off. He's saving at least $1,000 just by that one procedure. So we continue to add to our program. So that's a little bit about what exactly is direct primary care, but why, and why did I want to go into this? So there's several reasons. The first one is, unfortunately, the system is failing you as the patient, and it's also failing us as physicians. I think we have unanimous agreement, if you would go and poll doctors and patients, is the system working for you? Unfortunately, it's probably not working very well. America has a fantastic high acuity system. If you're having a heart attack, if you're in a car accident, if something bad happens to you, we will take care of you. You will get the best care available. But as soon as we find out it's not high acuity and it falls down, unfortunately, we start to push things out and further away. And that's where people are left hanging, and the follow-up and the treatment has possibilities and loopholes of taking good care of folks. And it's not the people. We have fantastic physicians. We have wonderful surgeons. We have the best nursing staff in the world. It's not the people, it's the system. It's the model, unfortunately, that's creating some of this. So if any of you have ever seen this before, if you've ever tried to map out your healthcare experience, this is the honest to God, true pictogram of your healthcare experience. So my computer has all of our pictures on the right side. So you probably can't see that the patient is in the lower right-hand corner and the physician is in the lower left-hand corner. So you as the patient aren't even the center of attention in your own healthcare. It's the Secretary of Health and Human Services. So you can see this is very complicated and very difficult to navigate. It doesn't have to be this difficult. It can be much simpler. And as the words of one of my patients, and they explain their experience with us, they say it's simple. I pay him the fee and he takes care of me. We don't have to run through all these pictograms and go through all these agencies. Unfortunately, the current system of healthcare, it rewards procedures and it rewards volume. So we want those folks, sent to the hospital because that's what they are rewarded for. Physicians are generally caring. They're smart. They're thinkers. They want to use their brains to help people with their healthcare decisions and deliver high quality. But unfortunately, the current system doesn't promote that, and now we're waiting in waiting rooms for what ultimately ends up to be rushed care. So the next slide is, again, with all of your businesses, I think one of the main points everyone needs is, what's your purpose? Why are you here? What is it that you want to do with your business? All of us want to make a living, that's true. But unfortunately, I've learned, I'm sure all of you have learned, if money, if lifestyle is your purpose, you're probably going to be miserable anyway, because there's never enough money and you're never going to have enough time off to do what you want to do. So you need a deeper purpose. For me, I knew I could deliver better quality, higher quality care to people. So that's my purpose. That's what drives me every day. And if I could deliver that, if I could package it up into a way to bring affordable healthcare to the people, that's the model that I wanted to deliver. And that is the purpose that we're going for every single day. Obviously, we want to make money. We want to be happy. We want our family taken care of. But again, what's the driving focus? And it's better quality, lower cost for all of our people. So again, jumping back a little bit to my story, why did I change? I told you that I felt like I could do a better job. So that was priority number one. In my quality years, we were trying to attain what's called the triple aim. So it's high quality care, high patient satisfaction at reduced cost. What I learned, unfortunately, the system just kept throwing more and more money at the problem to see if it would fix it. The problem is that just kept raising and raising cost, and we couldn't peel those layers away and hit all three tenets. So that became very frustrating, unfortunately. For me, I wanted to offer, ways of people to access the healthcare system. When I call my mom, she's always telling me about her healthcare experience. And it always starts with, I can't even get through on the phones. I can't talk to my doctor. I can't get through to the schedule. I can't talk to the nurse. What do I do? So I tell her, join a DPC, of course. But in her setting, that's not going to work. So trying to offer options. And that's one of the things that we're trying to do, is offer ways for people to communicate with us. We throw out there, we embed email, texting, and video chats included in our fee schedule for our memberships. We expect it. That's part of what we offer. And by doing that, we've had many visits where people, just clock out for 5 minutes. We do a web chat like this on Zoom. We answer their questions. Everything is happy. We send in meds or mail meds to the patient. We give them ideas of, labs we need to do. They're happy. They didn't have to clock out of work, drive across town, sit in the waiting room for 2 hours. They got their questions answered when they had their questions. What we've learned from that is we're able to lower the cost drastically. Obviously, just the out-of-pocket costs, as we've already gone over, but we've seen examples, especially with businesses and businesses wanting to provide insurance to their employees and wrap direct care into their product, that they've actually been able to lower insurance premiums. We've seen it, and we've seen it repeated. We've actually seen examples where the insurance company will send a refund back to the business because they're not sending in too many claims. So now they're getting refunds. They can reapply those refunds back into their insurance product, which ultimately lowers the cost for the employee even more. We've seen this, and it works time and time again. Obviously, the lower out-of-pocket costs that we discussed with the wholesale and cost pricing. But again, at the patient level, we're trying to keep people away from those high-cost centers. We want to keep them out of the emergency room. We want to keep them out of the hospital. We want to keep them away from the specialist unless they absolutely need to be there. So one of the things I try to tell our folks is, over the last 5 years, our practice has sent 10 people to the emergency room. We've actually told them, you need to go to the emergency room 10 times. Every single one of those people was admitted. 2 of them went directly to the operating room. 1 of those people went directly to open heart surgery. So they really needed that care. Now, we've been called many, many times, and patients have asked, should we go to the ER? And we oftentimes, just ask them what's going on. And we say, no, don't go. Come in, we'll take care of you, see us at our office. That is something that we can take care of and will keep you out of those high-cost centers. So again, our major goal with helping people use their healthcare dollars wisely. So for all of you, your small business owners, how does it affect businesses, families, and individuals? As you all know, insurance is expensive and it's only getting worse. I know I've watched my premiums go up every single year for the last 20 years. I never paid attention to it before that, but since then, every single year. Now it goes up by a different percentage maybe, but it goes up every single year. Now, people like yourselves, small businesses, self-employed, individuals, nonprofits, I mean, how are we supposed to keep up with this rate of increase that's much steeper than inflation? So we're forced with a decision. Are we going to keep our business alive and do our purpose, or do we buy health insurance for our staff? How do we keep them healthy? How do we retain our staff? Because now you guys are seeing a lot of these folks are actually leaving your job that they love because they want benefits, and they'll take lower paying job. They will just to get the benefits. And unfortunately, what they learn is they still can't afford healthcare because they still have copays, they still have deductibles, and they can only afford so much. So now they're stuck. They have a lower paying job. They have an insurance product that doesn't meet their needs, and they're still sick because people are avoiding healthcare because it's too expensive. All that leads to is greater problems down the road because we're not addressing the healthcare of the individual where they are in their healthcare journey. So please keep note that I'm not anti-insurance, not at all. I have insurance and I promote it to all of our patients and our clients. Most of our patients have insurance, but not everybody. But what we are is pro-efficiency. And most people just need to understand that insurance is really a risk modification tool. How much risk are you willing to accept? And insurance helps cover and blanket that, no matter if it's property and casualty, if it's car, if it's health. It's a balancing act all the times. So we're happy to work with others and help them be more efficient. And in all honesty, our best clients are insurance agents and insurance brokers because they understand the system. And they understand that we're not trying to bash insurance. It's a good thing, but let's promote, let's sell the right product that works for the individual for what their needs are, and help them along those ways. So we don't want to reinvent the wheel. Like I said, all of our clients are they're encouraged to have insurance. So the second greatest misunderstanding is that our practice is only for the uninsured. Yes, we have many uninsured patients, but that is not our target audience. We will take care of them, but that's not the idea. I've actually had some people call and say, hey, I love your service. I love what you've done for us, but we decided to get insurance. So my understanding is we have to quit. I say, what? Why do you have to quit? Well, I have insurance now. And then we go down and explain, no. Most of our clients have insurance. We can help you with that. Now you have the best of both worlds. You have an option of, is your healthcare covered under your insurance? And if not, we have our arrangements that we can help you with. And basically now you look at how are you modifying your risk? Now you have a blanket to cover you should you get hit by a car, should you have a heart attack, should you get cancer. That's what the insurance should really be used for, because now you can afford the primary care piece. So with that being said, the high deductible, low premium plans really are the obvious choice for people to choose. Of course, they need to choose on their own based on their own comfort, their own cash flow situation, and what their risk is. But that, from a dollars and cents perspective, really makes the most sense. Catastrophic plans are just that. They're a catastrophic, high deductible, low premium plan. You have to be careful with the wording. I have disclosure, I'm not an insurance broker. I can't discuss insurance in detail, but that's the catastrophic plan is really designed for the young adults, under age 30, who they're healthy. The only problems they're going to have is if they get hit by the bus, and they want coverage for that. Now, for businesses, the self-funded and really the level-funded plans are those tools that really make a lot of sense for small businesses to offer both an insurance product that covers that risk and to carve out what isn't included with the direct primary care model for all of the everyday primary care needs at that low cost. These are examples of where I see businesses actually getting rebates back from the insurance company because they're not abusing their claims fund. We can talk more about that later if interested. People are becoming savvy and they've learned about the mission-driven health sharing programs that are out there. I didn't know much about them, so I've done some homework and some research. It is not an insurance product. It's clearly labeled as such. So people need to understand what they're getting into, but honestly, the people who understand the product and pair it with what we have in our practice are actually the happiest because they understand how it works. The health sharing is really the catastrophic coverage. It does not cover pre-existing conditions, does not cover average everyday office calls and visits. What it does cover are those big catastrophic things. And when you pair it with us, you're getting perfect harmony between what's covered with the mission driven, which we don't cover. Obviously, we can't take care of a heart attack at the time of a heart attack or a bus accident, but we can take care of everything else, which is what the mission driven health sharing doesn't cover, the day-to-day and the pre-existing conditions. And never in my wildest dreams in a million years did I think I would say Medicare is a viable option as a partner with direct care. And the reason I say that is Medicare can be your catastrophic, your high deductible. It's actually not a high deductible, but it could be your insurance plan wraparound product. What a lot of individuals are getting lured into is paying the high dollar premium for the supplement that goes with Medicare. And they don't really fully understand how that works. So you could leverage that supplement, that secondary insurance with a direct care model, especially for the folks in the Medicare who want that relationship with their provider. They want someone who's going to hold their hand, someone who's going to take the time with them, who's going to explain things to them, and are going to answer their calls when they call in, and are able to communicate by email so they understand what it is that we're trying to accomplish with them. Unfortunately, like I said, the current healthcare system is driven by volume, and providers just don't have time to give that level of service to this group. And quite honestly, the Medicare group isn't what it used to be. 65 today is much younger than what 65 was 20 years ago. So 65-year-olds are healthier, they're younger, they're more active, and they're more savvy. So not everyone is sick and just trying to enjoy the last 10 years of their life anymore. How does direct care affect your employees? What we see, what works best in our practice is where the employee actually covers a DPC membership and they pair it with the health insurance product in a way that doesn't overlap services like we discussed previously. And by doing that, you are actually offering a comprehensive plan. In many ways, a plan that is actually better in cost and better in service than if you were to buy a gold or a platinum insurance product. And by doing that, again, what are your goals as a employer? A, you want to keep your employees at work. B, you want to keep them healthy, but probably most importantly, you want to retain your talent. Turnover is very expensive and you want to prevent that. There's even arguments with some of our health and wellness programs that we do included in our services to help reduce workman's comp claims. But that's a different discussion all in all. We like to compare health insurance with car insurance. So I bet none of you have insurance that covers fuel fill-ups, oil changes, or wiper replacements. And the reason is because you can afford it. it would be way more costly if you were to buy an insurance product to cover those things. But you do have insurance that covers wrecks and hail damage because that's unpredictable and expensive. So we just take that model and move it over to the healthcare, and we say, hey, let's look at insurance as a risk modification tool, and let's insure cancer and heart attacks, things you can't afford and things you can't predict. But let's carve out the primary care piece and make it affordable. That way we can lower insurance premiums and lower the cost of healthcare delivery across the board, and arguably get better outcomes in the end because we have the time to meet your goals where you are on your healthcare journey. The project management triangle is pretty complicated. Each of you certainly understand this being your own business owner. I won't go over this in detail, but you're always trying to balance the time versus cost versus quality of your product. And this is the age-old dilemma that you have to work on. So for us, finding that perfect scope of change is exactly what we need to do to try to find the sweet spot. Again, more detail on what we need to do here. So with this slide, I want people just to take a quick look at lab fees. These are examples of lab fees in our office, and I compared them to what the traditional regular price is in the retail market. And we call this a therapeutic middlemanectomy. So if we cut the middleman out of the equation, what is the actual cost? So I don't want you to get caught up in what the labs are on the left. If you just look at that quickly, those are examples of common labs that we all see. But look at the percent savings in that right column. On average, 90% savings from the exact same lab for the exact same lab company if you used our company compared to the traditional model. I've had patients that have come back from other places and they've spent hundreds of dollars on lab fees. I'll use one example, $700 to see the endocrinologist. So I look at the labs, I run them through our panel in the exact same labs, and I ran them, and it was $40. $40 for the exact same lab. In fact, it was the exact same lab company too. So again, I'm not sending and outsourcing to Mexico and to China just to get cheaper product. So I thought I'd use another example. I told you we dispense medications. So what if we compared some of the common drugs in the left column that you guys may see or use or heard of, and we compare our prices to the traditional big retail pharmacy. So again, let's look at the right column, the percent savings. On average, 80% savings getting the same drug from the same wholesale drug company in our practice compared to another location. Those costs add up fast. So in our practice, a patient who takes 4 chronic medications saves enough money to pay for their membership every single month. Just 4. Now that's not even counting labs. That's not counting that colonoscopy I talked about. That's not counting all those other procedures and services that we offer. So just the medications alone, and it's in our office, so you don't even have to go anywhere else, waste time and energy and money and gas and buy 6 other things because you're waiting in line at the other stores, which is their marketing panel. So that, that's what they want you to do. I went back and looked at our numbers from 2019, and these are the cost savings that we have demonstrated to our patients. Our patients saved $200,000 in prescriptions by getting them from our office, and they saved over $250,000 in lab fees. That's almost $500,000 just in savings for our patients. So I average that out, and I go, not everybody's average, but across all of our patients, that pays for half of their membership. That savings, if I averaged it out across everybody, they're getting half off of their membership fees, just by averages. Now, obviously, there's some people who are utilizing this more, and they get more savings. Other folks don't use it as much, so get less savings. Who's right for our practice? Well, everybody. I just thought I'd throw out, these are examples of businesses that have a business membership with us. I didn't drop any names. These are just industries. And I find it interesting. We have a nice complement of professional services with accounting and law and physical therapy, dentistry, optometry. along with labor services, automotive, plumbing, electrical, restaurant business, trucking. So across the board, we see a variety of different businesses who are seeing the benefit of what we do, and helping them keep not only their employees healthy, but again, if their employees are healthy and at work, you're going to keep the business healthy and meet the bottom line.
Todd, we need to wrap things up. We're running a little short on time, and
Absolutely.
I'd like to leave time for some questions. So,
Yep, absolutely. So I'll skip this page. So again, with our model, imagine working directly with the client, not working with third-party payers, less paperwork, better outcomes, a healthier community. How would that affect Lincoln if we could actually do that? How would it affect the economy and the health system? So, with us, we're very fortunate. We don't have to imagine that because that's actually what we're doing. And we have numbers to support it now. So perfect timing, Steve. I apologize for going over.
no, that's all right.
But
That was
welcome questions.
very informative, and I'm sure we have questions. So shout them out.
So improving outcome is kind of one of the holy grails of the setting up the setting up a healthcare system. That along with the cost efficiency. A given outcome for a given price. Are there like third-party metrics that or ways of getting certified or something so that like somebody could compare your business against some other business in some apples to apples way?
Great question, Gordon. So, comparing the metrics is the dogma of everyone looking at metrics and comparisons in healthcare. So when I was in the quality world, all I would hear from my counterparts is, that's not me, that's not my patient. I take care of sicker people. Someone else is doing something else differently. That measure doesn't measure what you're allocating the measurement to actually measure. So that argument goes on and on and on. There are a few white papers out there with respect to that. And you have to find the right measurement that actually measures what you want to report. And I'll give you a quick example. A1C is one of the measurements we use for diabetes. The lower the A1C, the better the blood sugar control. Unfortunately, because not everyone's on the same healthcare journey, it all gets diluted out. So for me, I could say, yes, I have an A1C of 6.0, which is outstanding. It's actually perfect. But I might be limiting my patients and not taking anybody new and not willing to take on anyone who has diabetes. I'm going to refer them out to a specialist. So cherry picking becomes an argument. Whereas someone else say, I take everybody. I take the sickest of the sick. I have people walking off the streets who just won't take their medications and their A1C is 15. So it's hard to compare apples to apples from that regard. There are some out there, not many. And the biggest reason for not many, cost. You got to get the right measurement and the right tool, and then who's going to pay for it? I hope that helps answer.
Okay, we have time for one more question. Anybody else have a question?
So Dr. Johnson, I have like two parts. What hospital are you associated with? And also, as a business owner, how would I determine how much it's going to cost me for like 3 or 4 employees?
Great question. So I'm affiliated with both Bryan and St. E's hospitals. I have privileges of both, and I still maintain those. So yeah, I purposely didn't put the cost schedule in here because I thought it would derail us a little bit. But if you go to the website, we have individual fee scales, which is based on age and age alone. That's our risk stratification tool. And I'll just share them with you really quickly. So young adults, young meaning between the ages of 20 and 44, are just $50 per member per month. If you're between the ages of 45 and 64 years of age, it's $75 per member per month. And if you're over 60 or 65 or older, then it's $100 per member per month. With a paid adult membership, all children under the age of 20 are just $10 a month. So that's the family plan. I just throw the kids in, basically. Now, as a business, what I offer is if you can align a roster of at least 5 adults on your roster. Now, I use that loosely because since I'm not insurance, you can offer coverage for spouses and independents who are not actually employees, so I'm not saying it has to be 5 employees, but if you have 5 covered adult lives, I give all those businesses the lowest rate of $50 per member per month. So if you have a 65-year-old, there's still only $50 per member per month. If you have a 55-year-old, again, at least 5 adult members on your roster, $50 per member per month. And the kids would still just be 10.
Thank you.
You're welcome.
Okay, well, unfortunately, we're out of time today, but I'd like to thank Dr. Johnson for joining us and explaining his new model for healthcare. It's exciting development, and I'll be anxious to follow the trend for DPC in the future. So, Dr. Johnson, thank you so much for your time today. Thank you everybody for joining us, and I hope you'll join us next week to hear Aaron Costers with Little Giants Foundation. Thank you all, and stay safe and healthy.
Thank you.
Thank you. Thanks for the time.